so this is an ophthalmoscope, so what it's going to do is it's going to let me look at the actual internal structures of your eye. If I were doing the exam as an ophthalmologist or in their office, I would be able to dim the lights down more and really get a good look at her eyes. Right now I'm going to leave the lights up just so you can see what I'm doing for my technique. So okay, and it looks like your eyes are good.
Okay.
All right, and then so now I'm going to check your ears. I see that you've got piercings in the lower. Any piercings in the upper? Anything I need to know about? Okay. All right. I just didn't want to accidentally grab and hurt you some. So you're just going to feel me feel your ears. Okay. So right now, both lobes, they're bean-shaped and symmetrical. The cartilage is firm. It doesn't look like she's got any tenderness at all whenever I'm feeling. I don't see any visible discharge right now, but I am going to look as well with the otoscope. Alright, so you're going to feel me pull your ear up and back some. Now look in. And I don't see any redness or discharge on this side at all. Any tenderness whenever I'm doing that?
No.
Alright, and then same for this side. Okay, so then both look good. Alright, so that's your ears, so your ears are done. So I'm actually going to come stand behind you right now because I'm going to test your hearing.
Okay.
So what I'm going to do is I'm going to whisper 2 words, and I want you to repeat back to me the words that you hear, okay? As I kick the bed, I'm sorry, I hope I didn't shake you there. So,
Ice cream. Milk.
okay, perfect. Now it's time, we've done eyes, we've done ears, now we're going to do your nose, okay?
Okay.
So once again, kind of the same thing, I'm just going to do some gentle touching, just so you get a feel for it. So it looks like your nose is nice and symmetrical. Have you ever broken it or anything like that that I need to know about?
Mm-hmm.
Any tenderness whenever I touch? Okay, so nice and symmetrical, don't notice any discharge. Do you ever have nosebleeds or any issues?
Mm-hmm.
Okay, and then I'm just going to come across your cheeks some too. Any tenderness at all as I'm feeling across? All right, perfect. And now, what I'm going to have you do is, there's something inside this cup.
Okay.
I'm going to have you kind of close one nostril, sniff a little bit, close the other side, sniff, and I want you to tell me what's in it.
Okay.
Okay? So, yep, close your eyes. Okay,
Coffee.
perfect. And now we're going to do one other.
Apple juice.
Awesome! You did very well with that. Any difficulty with that? Like, did you feel stuffed or anything like that? Okay. And then what I'm going to do is I'm also going to go ahead and do a light again so I can kind of see up and
Okay.
in and make certain that there doesn't look like there's any blockages or anything like that that I need to be aware of.
Okay.
So I'm actually not going to be sticking this up in your nose just to let you know. It's just to kind of help guide the light some.
Okay.
Okay, so I'm going to have you go ahead. I'm going to have you tilt your head forward for me some. And then I'm just going to look. And it looks great. Doesn't look like there's really any irritation or anything like that. So you are lucky with all of that so far. Okay, now we're going to move on to the mouth.
Okay.
And have you had your mouth inspected before with a tongue depressor and all that fun? Okay, so go ahead. Can you stick your tongue out for me just so I can see it? Okay. Any injuries to that or ever had a piercing or anything I need to know about? All right. And so what I'm going to do is I'm going to have you stick your tongue out, a little depressor, and then go ahead and say ah for me. Perfect. Looks good. Sorry, I think I clicked your teeth there a little bit, didn't I? Okay. So then I'm going to go ahead and I'm going to just take a peek at your teeth and kind of look around some. Very good. All right. So I don't see any type of redness. It looks like it's all within normal limits. And then, so her tongue is pink. There doesn't look like there's any lacerations or spotting or color changes to it. Teeth are intact and white. And then also it looks like the oral mucosa is all intact and moist with no issues. So it looks like overall, like your mouth is within normal limits, which is good.
Okay.
And then looks like lips. Can you smile? All right, so lips, you smile evenly. You're not cracked. Do you ever have cold sores or anything like that?
Mm-hmm.
Okay, also very lucky then. So it looks like everything's pink, intact, and
Excuse me.
exactly what I would hope to find for a normal assessment. And then how about your swallow? Can you swallow real quick just so I can watch? I know, on a dry mouth, it's very nice, isn't it? So whenever you swallow, do you feel it like there's a lump or that it's difficult to swallow?
Mm-mm.
Okay. Now what I'm gonna go ahead and do is I'm gonna start feeling on your neck. I'm feeling for both your carotid pulses as well as your thyroid gland and then your trachea, which is your windpipe.
Okay.
So I'll just kind of work my way through it. So I'm just gonna, this first one is the trachea. So just kind of feeling along, making certain that it's not deviated, which means it's not to one side or the other. And it looks like overall, like your neck is straight and symmetrical. Your trachea is midline, straight and palpable. And then for your pulse, I'm gonna check your carotid. I'm gonna do both sides. Okay, it looks like your carotid is about a 2+, which is good. It's nice and easily palpable. And I'm gonna listen. I'm just gonna kind of slowly work my way down. And I don't notice any bruise or any other abnormal findings for the carotid. And then for your jaw, can you just move it a little bit for me? Okay, any pain with that at all? Okay, so it looks like your jaw moves smoothly and evenly too. Now I'm gonna come stand behind you again. And what I'm gonna do is I'm gonna reach around. This is so I can feel your thyroid.
Okay.
So your thyroid gland, the reason we do this is that it's the easiest way for us to feel it. So if you could go ahead and swallow for me. Sorry, I know on a dry mouth, that's not the easiest thing to do. And then swallow one more time for me, please. Okay, perfect. And then, I'm just gonna feel, sorry, I know my hands are cold. All right, so the thyroid is palpable. I don't feel any nodules at all. And even when I'm feeling from behind with the trachea, it feels midline, straight, and no issues. All right, so that's the first half of the assessment. In just a little bit, I'll get you set up and then we'll do the second half.
Okay.
All right,